Hi, it's a pleasure for me to talk to you about my personal clinical experience with Stabha, SportVis, in the management of tendon and ligament injuries. I'm a Fabio Krebs, I'm an orthopedic surgeon. I work in Brazil, and I have a long experience in treatment of athletes, professional and amateurs. Then is an experience that I have used this option of treatment. I declare conflict of interest in this presentation. What is Stabha? Soft tissue adapted by a compatible hyaluronic acid. Personal experience that I have more than 70 years with excellent results. Benefits of Stabha in ligaments and tendon. Soft tissues adapted because of its high biocompatibility that is a result of its purity profile that's achieved with an exclusive patented manufacturing process. Injection forms a gel-like complex, Stabha plus fibrin, into the injury site that provide larger hydrodynamic volume in situ, acting as a cushion for physical support. Scaffold effect, which provides support internally, increase cell proliferation, and reduce inflammation. With the results, better realign quality, less scar tissue formation, provide lubrication, hydrodynamic volume to reduce adhesion, and allow better structural configuration of fibers, faster reconstruction and recover. What's indication of Stabha? Medial and lateral elbow epicondylitis, ankle sprain with ligament injuries, rotator cuff tendinopathy. Another effectiveness and tissue recovery in patellar tendinopathies and ruptures of Achilles tendon and plantar fasciitis off-label in this moment. In the shoulder and ankle, the feeling of cooling of the infiltrated segment occurs shortly after the infiltration. In the elbow, as a structure with less space for expansion of the viscous supplement, painful discomfort may occur in the first 24 hours. I performed this treatment in acute ankle sprain, which have provided a very adequate anatomical realigned recovery with practically no injury recurrence. That is so important when you have an ankle sprain with ligament lesion. Stabha a good option in the treatment of ligament and tendon injuries. Is not considered doping by WADA and can be applied to professional athletes. It's important information for the doctors that treat athletes, professional athletes. What's the injection technique? It's important to do a septic method with gauze with alcoholic chlorhexidine, anterolateral, posterior, medial, and superior. That's possible. Indicated needle 21, 27 gauge. I prefer 21 gauge with a 1.5 inch. This is a technique of infiltration in rotator cuff tears from proximal to distal and vice versa, usually supraspinatus and subscapularis in the elbow, in the shoulder, excuse me. Guided by ultrasound is possible. A periarticular technique infiltration in the elbow, place the needle at 45 angle in relation to the point of maximum pain. Infiltrate the point of maximum pain in the side of medial or lateral epicondyle, usually wrist extensor and wrist flexors. Inject while the needle is removed. This is important. In the trajectory and the way of the ligament and tendon. Return without removing it completely. Rotate the needle 108 degrees for the opposite direction and insert the needle again parallel angles to the skin at the point of maximum pain. In the ankle, a periarticular infiltration during one penetration and the level of the ligament that have injuries. Guided ultrasound optional. Infiltration should be performed in 3 planes: anterolateral, anteroposterior, and anteromedial, taking as a reference the initial point of the ligament. The second infiltration must be performed between 2 to 7 days from the first infiltration. After infiltration, you can use micropore tape or band-aid. That's just this. MRI or ultrasound before the infiltration, I have a preference to do. Follow up to observe the realign process, the shoulder and elbow 4 to 6 weeks later, ankle 6 to 8 weeks later. I see the possibility of assisting in the realignment process of label in surgical procedures for tendon repair, where it couldn't benefit in the complete tendon tear, Stabha application after suture, when you have one lesion with rupture. I consider that the radiological image performed before and after the infiltration of the Stabha can show the recovery and tissue regeneration of the affected segments, being an important data to verify the effectiveness of the therapy. Contraindication, patients with dermatosis in the infiltration region to avoid possible secondary infection. I will show for you some clinical cases. Documented cases showing previous and posterior radiological images with SportVis application and the tissue recover. This is a man, 35 years old, with a lesion of anterior talofibular and calcaneofibular ligaments, and after application of the Stabha ligaments, lesion recovered and realigned. We can show before and after the recovery of the ligaments, and the recover, he recuperated the ankle of the motion of the disarticulation. This is another case with a partial tear of anterior fibulatalar ligaments and deltoid ligament strength after application of the Stabha ligaments without any alteration. Stabha infiltration before and after, showing the lesion totally recovered, the ligament that was damaged. This is when you have the arc of the movement of the ankle with totally recovered too. This is another case with rupture and anterior fibulatalar and fibrocalcaneal ligaments with a complete ruptures after application of the Stabha ligaments with cicatrization totally recovered. Before with the lesion and after the ligament recovered. This is another case with a rupture of anterofibulatalar and fibrocalcaneal ligaments, two ligaments that are damaged. And when you do infiltration, you can show in the MRI the ligaments recovered with cicatrization before the lesion and after application of Stabha with the recovered ligaments that was damaged. This is another case with anterior fibulatalar ligament rupture, total rupture, and after the MRI showing ligament with cicatrization, and you can show in this image. Before the lesion, after application of the Stabha with recover. This is another kind of treatment that you can use in Achilles tendinopathy or Achilles partial rupture. This case, approximately 90% of the rupture, the Achilles tendon. We can show before the practically totally rupture of the Achilles tendon, and after infiltration, recovered almost totally the Achilles tendon with recover the mobility of the ankle. This is another case with tendinopathy with 50% rupture in the calcaneal tendon, showing in this MRI that you can see an impossibility to do a fully flex the ankle. And after, you can show discrete paratendinitis of the calcaneal tendon without rupture, totally recovered practically after the infiltration of Stabha. Here showing the lesion in the MRI and show recover. In this case, too, with the recuperated the ankle of motion of the ankle. Here's a protocol that Football Club Barcelona medical staff, clinical and radiological diagnosis with ultrasound, grade 2 ankle sprain, infiltration guided by ultrasound, that this club, the Mundial club, used it, the doctors of the Barcelona. In the hospital Mãe de Deus where I work, standard protocol, traumatology service, shoulder, elbow, ankle, and foot pathology with excellent results. We have some consideration. Very useful tool to help realign and recover of injured tissues with an improved biological pattern. More anatomic cell signs, less rigid and adhesion mechanic effect, improvement of connective tissue lubricating effect indicated for acute and chronic cases in amateur, professional, and non-sports athletes patients. SportVis, a therapeutic modality that helps in tissue recovery and regeneration, promoting better and more adequate realignment. It's very important method of that assists significant decrease in recurrence of injuries, principally in professional athletes. Stabha allows to have early return to mobility, of course, in your activity, in sports activities. It's very important to have a good infiltration technique to obtain the success of the treatment. There are a large bibliography that you can see since 2007, and I hope that you can understand that this is a beautiful option to treatment the lesion, tendon and ligament lesions that have some kinds of treatment, and I have a lot of doubts, but the application with infiltration with Stabha is recover in the lesion that provide a totally recuperation and recover the mobility of the segment that was compromised. It's a pleasure for me. I talk again, and I hope that you understand some things, and I would like to talk with you in another moment. Thank you so much.